Hello everyone, my name is Abhishek. I'm currently pursuing my integrated MTech degree in software engineering at VIT University. As you can see on the screen, our topic today is depression. So in the first place, what is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness or loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. When you have depression, it interferes with daily life and causes pain for both you and those who care about you. Depression is a common but serious illness. Feeling sad is a healthy, normal part of life. For some people, sadness comes out of nowhere, triggered by something as simple as a song that comes on the radio. For some people, feelings of sadness won't go away and the origin of sadness is hard to find. It is not something that they can snap out of or control. It causes feelings and thoughts that won't go away. Many lose interest in normal daily activities, lack energy, and have trouble concentrating. These are all signs of depression. A mood disorder is also referred as clinical depression or major depressive disorder. If you or someone you know suffers from depression, you are not alone. Over 16 million people in India experienced depression last year. Depression is a treatable condition and help isn't too far. Symptoms. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activities or slowed movements or speech, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks and must represent a change in a previous level of functioning for a diagnosis of depression. Also, medical conditions like thyroid, a brain tumor can mimic symptoms of depression, so it is important to rule out general medical causes. Types of depression. There are many different types of depression. Events in a life cause them, and chemical changes in the brain cause others. The various types of depression are major depression, persistent depressive disorder, bipolar disorder, seasonal affective disorder, which is also known as SAD. Whatever the cause, your first step is to let your doctor know how you are feeling. They may refer you to a mental health specialist to help figure out the type of depression you have. This diagnosis is important in deciding the right treatment for you. Major depression symptoms you might have are loss of interest or pleasure in activities, weight loss or gain, trouble getting to sleep or feeling sleepy during the day, feeling restless or agitated, or feeling very sluggish and slowed down physically or mentally, being tired and without energy, feeling worthless or guilty, trouble concentrating or making decisions, thoughts of suicide. Your doctor might diagnose you with major depression if you have 5 or more of these symptoms on most days for 2 weeks or longer. At least one of the symptoms must be a depressed mood or loss of interest in activities. Major depressive disorder has been ranked as the third cause of the burden of disease worldwide in 2008 by World Health Organization, which has projected that this disease will rank first by 2030. It is diagnosed when an individual has a persistently low or depressed mood, decreased interest in pleasurable activities, feeling of guilt or worthlessness, lack of energy, poor concentration, appetite changes, agitation, sleep disturbances, or suicidal thoughts. This activity reviews the evaluation and management of major depressive disorder, which is one of the main causes of disability in the world, and highlights the role of the interprofessional team. Persistent depressive disorder. If you have depression that lasts for 2 years or longer, it's called persistent depressive disorder. This term is used to describe two conditions previously known as low-grade persistent depression and chronic major depression. You may have symptoms such as change in appetite, sleeping too much or too little, lack of energy or fatigue, low self-esteem, trouble concentrating or making decisions, feeling hopeless. Persistent depressive disorder is a continuous long-term form of depression. You may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem and an overall feeling of inadequacy. These feelings last for years and may significantly interfere with your relationships, school, work, and daily activities. If you have persistent depressive disorder, you may find it hard to be upbeat even on happy occasions. You may be described as a person with a gloomy personality, constantly complaining or incapable of having fun. Though persistent depressive disorder is not as severe as major depression, your current depressed mood may be mild, moderate, or severe. Because of the chronic nature of persistent depressive disorder, coping with depression symptoms can be challenging, but a combination of talk therapy and medication can be effective in treating this condition. Persistent depressive disorder symptoms usually come and go over a period of years, and their intensity can change over time, but typical symptoms don't disappear for more than 2 months of a time. In addition, major depression episodes may occur before or during persistent depressive disorder. This is sometimes called double depression. Bipolar disorder. Someone with bipolar disorder, which is also sometimes called manic depression, has mood episodes that range from extremes of high energy with an up mood to low depressive periods. When you are in the low phase, you will have the symptoms of major depression. Medications can help bring your mood swings under control. Whether you are in a high or a low period, your doctor may suggest a mood stabilizer such as lithium. Traditional antidepressants are not always recommended as first-line treatments for bipolar depression because there is no proof from studies that these drugs are more helpful than a sugar pill in treating depression in people with bipolar disorder. Also, for a small percentage of people with bipolar disorder, some traditional antidepressants may increase the risk of causing a high phase of illness or speeding up the frequency of having more episodes over time. Psychotherapy can also support you and your family. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs and lows. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to hypomania, you may feel full of energy or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, which is known as psychotherapy. There are several types of bipolar and related disorders. They may include mania or hypomania and depression. Symptoms can cause unpredictable changes in mood and behavior and difficulties in life. Seasonal affective disorder. Seasonal affective disorder is a period of major depression that most often happens during the winter month when the days grow short and you get less and less sunlight. It typically goes away in the spring and summer. If you have seasonal affective disorder, antidepressants can help, so can light therapy. You will need to sit in front of a special bright light box for about 15 to 30 minutes each day. Seasonal affective disorder, which is known as SAD, is a type of depression that's related to changes in seasons. Seasonal affective disorder begins and ends at about the same time every year. If you are like most people with seasonal affective disorder, your symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and the summer months. Less often, seasonal affective disorder causes depression in the spring or early summer and resolves during the fall or winter months. Treatment for seasonal depressive disorder may include light therapy, psychotherapy, and medications. Don't brush off that year feeling as simply a case of the winter blues or a seasonal funk that you have to tough out on your own. Take steps to keep your mood and motivation steady throughout the year. Alcoholism and depression. Research has shown that there seems to be a bidirectional relationship between alcohol use disorder and depressive disorder. Both disorders can exist together. Each disorder increases the risk for the other disorder, and each disorder can worsen the other. regardless of the order of which came first, alcohol use disorder or a depressive disorder. Both issues are among the most prevalent psychotic disorders and co-occur often. The pathways leading to the development of co-occurring alcohol use disorder and a depressive disorder are complex and intertwined. Some individuals may be genetically vulnerable to both. For others, symptoms of a depressive disorder can influence the development of an AUD. One possible contributor to co-occurrence is that people may alleviate symptoms of a depressive disorder with substance like alcohol. People who experience major depressive symptoms may start to rely on alcohol to ease their symptoms and feel better, but over time this can develop into a full-blown alcohol use disorder. Even in instances where a person doesn't develop an AUD, self-medication may not be helpful long-term, as it is associated with increased psychotic comorbidity, higher stress levels, and lower health-related quality of life. Research also has associated AUD with the risk not only for the onset of depressive symptoms but also depressive disorders. It's important to note that the co-occurrence of AUD and depressive disorders, specifically major depressive disorder and persistent depressive disorder. It's important to note that the co-occurrence of AUD and depressive disorders and major depressive disorder and persistent depressive disorder is associated with greater severity and worse prognosis than either disorder alone. This includes a heightened risk of suicidal behavior. It's a vicious spiral that can be difficult to overcome, however, treatment can be effective. Can alcohol make depression worse? Yes, alcohol can make depression and depressive symptoms worse. In addition, a clinical reviewer in the journal Professional Psychology, Research and Practice explains that drinking can interfere with recovery from depression. Depressed study participants who are heavy drinkers displayed worse outcomes from depression. Furthermore, even mild to moderate amount of alcohol appear to worsen depression, with the depressed patients who drank low levels of alcohol experiencing worse outcomes from pharmacological treatments. Alcohol use disorders may be more prevalent in people who also have depression than they are in the general population. The occurrence of alcohol use disorder and a depressive disorder are associated with greater severity and a worse prognosis for both disorders. Treatment for co-occurring depression and alcohol use disorder. Treatment often includes an integrated approach to simultaneously address both alcohol use disorder and depression. Many treatments can help co-occurring depression in AUD. Some of these include detox, antidepressants, medications, behavioral therapies. Detox. The alcohol detox stage is the first step in treating alcoholism. During this time, alcohol is completely flushed from your body. Withdrawal symptoms typically subside within approximately 1 to 2 weeks after starting detox. However, this could take longer depending on the severity of the AUD. From there, you will be able to focus on other aspects of the recovery process, such as different activities, therapies, counseling sessions, and support options. Alcohol is a depressant that your body begins to rely on over the course of months and the years of drinking. Your brain eventually stops producing certain chemicals that it receives from alcohol, becoming dependent on the drug. That's why when you quit drinking, it takes time for your body to adjust. This is what causes withdrawal symptoms such as headache, fever, irregular heartbeat, and hallucinations. Some people are apprehensive to quit drinking because they are nervous about the withdrawal symptoms experienced during alcohol detox. While some people may only be affected by minor effects of alcoholism, others may face extreme pain. Withdrawal symptoms can change quickly and aggressively, which is why it's important to detox under the care of medical professionals. Treatment professionals at a rehab facility will be able to help you manage your pain with different medications. This allows you to focus on your recovery and get better. Antidepressants medications. You may receive antidepressants which can help treat both the depression and some symptoms of AUD. In addition, you may receive a medication that helps people stop drinking and reduces depressive symptoms. Disulfiram, which is used as an alcohol deterrent, is used to help maintain distance from alcohol. Antidepressants can help relieve the symptoms of depression. They can also help to treat social anxiety disorder, other anxiety disorder, and seasonal affective disorder. Behavioral therapies. Behavioral therapy is an umbrella term for types of therapy that treat mental health disorders. This form of therapy looks to identify and help change potentially self-destructive or unhealthy behaviors. It's based on the idea that all behaviors are learned and that behavior can be changed. The focus of treatment is often on current problems and how to change them. These can include cognitive behavioral therapy. This helps you learn possible coping mechanisms to replace the thought and behavioral patterns that can contribute to or worsen AUD and depression. Dialectical behavioral therapy. This is mainly used to help reduce self-harm and suicidal behavior. Behavioral activation. This is a type of behavioral therapy that is effective for both AUD and depression. It involves developing an understanding of how negative life experiences and behavior influence your mood and emotions and encourages you to take an active approach to increase a positive life experiences. Mutual support groups, which include 12-step groups like Alcoholics Anonymous and non-12-step groups like Smart Recovery. These groups are effective both as treatment and as aftercare for both AUD and depression. You will benefit from the support of others who know what it's like to be in your shoes, which can lessen feelings of isolation and help you feel connected. I have now come to the end of my presentation. I think you guys got an idea about what is depression and how to overcome it. Thank you.